kind of the structure and how you fit all that information into an 8-week class. How does that work?
Okay, so we are an accelerated class, but we are geared toward the people that are adults. Okay, this is a program that is strictly for adults. You need to be 18 years of age or older, and do have a wide range of people in that category. So basically, how we squeeze that in. For example, I always start out the course with a lot of in-depth information on phlebotomy, because I like to get that book information to the people right away, so that we can get that preliminary basic structure down. And then we spend the next 7 weeks basically practicing and refining our hands-on skills with doing a venipuncture procedure, or possibly a dermal punctures, which are also included with those blood drawing procedures. So we start out there. And then the bulk of the course is primarily anatomy and physiology. And we go through each of the body systems. You have a lot of different systems in your body that work, such as a urinary system, respiratory system, musculoskeletal system, a lot of different systems in your body that work together to make you healthy and well. So in with the anatomy and physiology, also there is medical terminology that I prefer to teach with the body systems, so that, for example, when we're talking about the urinary system, I will be sharing medical terminology with you that you would hear in that doctor's office, or possibly the nephrologist's office, or whatever have you. Terms like dysuria, polyuria, oliguria. These things should be taught with the body system, so that the students can recognize what things go together. And then after that, we have 1 week, which is kind of the hardcore week, which is our week 5, to where we just basically will address the cardiovascular system. And with that cardiovascular system, once I've acclimated you and taught you to how the heart actually works, then we can move into the EKG, where you actually place the leads. I show you how to do that. And then as we go along toward the end of that week, then I teach you the interpretation of those EKG rhythm strips, to where you will be able to look at those spikes and those bumps, and you will be able to tell what is an atrial fibrillation. You might be able to tell what is a sinus bradycardia. And this is really something good that we have here, because it's my understanding that not all of the programs will actually offer that interpretation piece. So for us, that works really well. And then toward week 7, we go over office procedures, a little bit of insurance and billing coding. We kind of touch on the basics of those things. We talk about pharmacology, because with being a CCMA, you will actually be able to give medications to the patients under the doctor's direction and order, of course. So I also teach you about that. I'm trying to think what else. Oh, and then one of the nice things is that I've been able to incorporate into this program is week 8, or your last week, will primarily be a review of everything we went over from week 1 all the way through to the end of week 7, so that on week 8 we're looking at all that stuff, and you're kind of filling out some packets, and you're challenging yourself to kind of remember all those things that happened so many weeks ago. And it will help bring all of that information back to the forefront of your brain, in essence. And it will give you a much better chance of passing those certifications, because I'll bring your knowledge base all current and up to date. Because when I first started here, a lot of the students were saying, man, I don't know if I can remember all this stuff. It seems like all that stuff that we did at first, I can't remember now.
Mm-hmm.
So we like to bring it all together, finish it up, put a nice little bow on it, and I usually feel pretty confident with when the students leave, they should be able to pass their certifications, because we don't look good unless you look good. So
Sure.